Welcome to MedmatchMD Spotlight, where I highlight amazing Caribbean medical schools, alumni, and students. There is an enormous amount of misinformation online, so I have created MedmatchMD, a one-stop platform that helps pre-med students narrow down the decision of applying to offshore Caribbean medical schools by instantly comparing close to 40 schools with multiple requirements side by side. I am Dr. Ola Kolawole, board-certified family practice physician, Caribbean Medical School graduate, and founder of MedmatchMD, where I help pre-meds and non-traditional pre-meds just like you make an educated decision of choosing the right medical school so you can fulfill your dream of becoming practicing physicians in the United States or Canada. So, let's get started. I am your host, Dr. Ola, and this is MedmatchMD Spotlight.
Okay.
Okay. Hello, everyone. This is Dr. Ola Kolawole, founder of MedmatchMD. Today, I have with me Dr. Tayo Akadiri. Dr. Akadiri is an anesthesiology resident at the University of Ocala, HCA, Florida. He is also a graduate of the amazing Caribbean Medical School, American University of the Caribbean, in the beautiful island of St. Maarten. Again, I would like you to welcome Dr. Tayo Akadiri as he shares his story and his journey through medical school as well as residency. Without much further ado, I have with me once again Dr. Tayo Akadiri. Dr. Tayo, thank you for coming on board.
Thank you. I appreciate it.
Okay. So today I have a few questions for you that will hopefully help our pre-med audience.
Right.
So first of all, I would like you to tell me a little bit about yourself. What got you into medicine? What
hmm
made you decide to go to a Caribbean medical school?
Okay. So first and foremost, I just want to thank Dr. Kola Ole for bringing me on to just talk about my journey through medical school. Throughout my career, like I've actually just made it like a thing to just help other people, like in careers, especially like knowing like what I had to go through to get to where I am today. A lot of struggles along the road, a lot of people giving me like wrong answers to the questions, that I wanted. A lot of wasted time, wasted months, wasted classes
Yeah.
that I didn't even like need to take to get to where I am today.
Oh, wow.
So how did I get into medicine? I'm originally from Nigeria,
Okay.
and when I was in Nigeria during high school, I was part of like a sport team. Like I played soccer,
Okay.
and this was my first, initiation into medicine. And a lot of people will get injured, like minor scraps and lacerations and scrapes, and in a week or two, like they'll feel better. The wound is almost healed.
Sure.
So this was my thought process, like how does this happen? How does the wound heal? Like
Mhm.
this guy had a laceration like 2 weeks ago.
Right.
Now it feels like new.
Mhm.
And I'm very, very intuitive person by nature. So, this got me thinking. And so I started shadowing a nurse back then in high school. And this is how I kind of like got into medicine a little bit, talking to the nurse, talking to the doctors. And then I moved into the States in 2011. So I kind of had an idea of what I wanted to go into.
Okay.
So, I started college. I was at a community college back then.
Okay.
And just like taking like biology classes, chemistry, organic chemistry, all that
Right.
college stuff. The good old days. So just taking those classes, and then I majored in medical lab sciences.
Okay.
So in medical lab science, like you like draw blood, you're a phlebotomist. You also look at the blood under the microscope. You run labs, you run chemistry, CBC, CMP. You look under the microscope for like fungus cells and stuff like that. So at this point, I'm like, this is very interesting stuff,
Mhm.
right?
Yes.
There's a difference, like when people tell you about what a medical condition is,
Right.
and when you actually sit under the microscope.
Right.
And so a lot of times now I'm in the hospital, and a lot of people talk about microcytic anemia, and like people just say it, but there's a difference when I've seen it under the microscope and I know what it actually looks like. Or you
Exactly.
talk about like a cancerous cell, and I'm like, oh, like okay, I've seen this before, so I know what it is.
Okay.
So this is kind of like what got me into medicine after college, after being in medical lab science. So my thought process was to probably do IM, internal medicine.
Okay.
That was my first thought process after college,
Hmm.
and probably specialize in oncology.
Okay.
Because after seeing all these lab cells, I was like, okay, this is something I want to be on the other side of
Right. Hmm.
prescribing the medication for. And and my other part there was pathology.
Okay.
Okay, because I was like, okay, since I'm
Makes
kind of
sense.
like in the same angle, like I'm gonna just stick with this
Yeah.
and just be a pathologist. And then like, oh, like a lot of the pathology like doctors back then were like my friends, like they were like always like teaching me stuff, like talking to me about like all the sensitivities and microbes and stuff. I was like, oh, this is pretty cool. So that was kind of my thing. And after college, I took a year off
Okay.
because I was like, I wanted like a time off before I chose another career.
Hmm.
And during this time, I was working as a medical lab scientist,
Okay.
and it was good pay. I won't lie about it.
Yeah.
Probably more than I'm making right now.
But hey, it'll pay off eventually.
Of course, 'cause it always pays off. It always pays off, and that's what I tell people that go into medicine is that don't do it for the money. Because if you're doing it for the money,
Yeah.
like this is the wrong career to go into. You're not gonna make money up front. It's
Yeah.
something that is gonna be down the road.
Right.
But after I took a year off, I'm a musician. Also, I play the piano.
Okay.
And my brother sang. So we did gigs for like weddings and birthdays,
Okay.
stuff like that. Just something on the side to make extra money.
Okay.
And after a year, we both got bored
Okay.
and both went to medical school.
Oh, wow.
Right.
Interesting. Wow. Okay.
Interesting. Yeah.
Did you attend the same medical
So
school?
he went to Saber.
Oh, really? Okay.
He went to
That's another,
Saber. It's
yeah.
like an hour like flight away from my place. It's a smaller island, but
Okay.
so he went there. I feel like being brothers, like we tend to like go like separate ways sometimes.
Yeah, yeah, I hear you. I have a sister who's just about a year and a half older, and we tend to want to do different things as well. So,
Right. Everyone's trying to prove
for
something.
themselves, right?
But so we went to the like medical school after the year off. He went to Sabre. I went to the American University of the Caribbean. I chose the American University of the Caribbean because of the smaller class size.
Okay.
So that was something that was big for me. Like I just didn't want to like be just one of the 400 students in some of the other schools.
Sure.
No, I'm not necessarily saying the other schools are bad. Like and now so some of them like SGU or Ross, like these are like big schools when it comes to like
Mhm.
Caribbean Medical School,
Yeah,
AUC, Sabre, Antigua, like and a lot of them have like the benefits and the disbenefits.
of course.
Um, so I particularly picked AUC because of the class size. Class size back then was like about 100 to 150
Okay.
uh, in the class,
Okay.
and going to like university and being like in the in the mix of like so many students,
Mhm.
and like the professor you can't even have the time to speak to your professor, and
Yes.
you have to like wait like hours to like like make appointments and stuff.
Yeah.
So that was something that was big for me going to medical school. I was like, I just I want to pick a school where if I have questions like after class, I can easily have access to professors. I can easily have access to office hours.
Yeah.
And so that was my biggest decisions. And I looked at like the ranking, I look at the board rates, and it
Mhm.
was pretty good, above 90%, I believe, back then for the American University of the Caribbean for
Okay.
the USMLE Step 1.
Okay.
So I was like, okay, so that's one thing you want to look at. Like, does this school prepare you to like
Right.
pass this board exams, right?
Yes.
Because some of the schools like I had there now, like the pass rate is like no and another thing you want to know is like is the pass rate on the first time or the second time, because
Right.
some of the schools like they will just put pass rate but they won't tell you how many tries to
Mhm.
like like to get that pass rate. So
Mhm.
that's one thing you want to start thinking about, like like is this the pass rate on the first try for the students,
Mhm.
or like after multiple tries.
Right. Right.
uh,
And
so
I believe AUC's pass rate for USMLE Step One, I believe it's 94%.
94%, yeah, I
Like,
think
yeah.
it did go up this year.
Right.
Like my class and the class after me, like a lot of smart kids, like bunch of smart kids,
Mhm.
energetic, hardworking people. So
Mhm. Mhm.
we pushed it up.
Yes. Yes. That's awesome. Wow. That's great. That's great.
But so I went there. Like my biggest decision was the class size, like I said, obviously, and then like the board pass rate,
Okay.
and just the island for me also. I think St. Martin is probably one of the most beautiful beautiful islands there is, out there. Like I have people from SGU, Ross that always actually come down to St. Martin to like just to hang out.
Yeah, yeah,
Uh,
yep. I remember when I
so,
was at Ross, a lot of us. Well, I didn't particularly go to St. Martin, but a lot of people will go after exams to just
right,
to hang out. Yeah.
right. So like I think that was like one of the big things for me. I was like, okay, it's a beautiful place. It's a small class size,
Mhm.
and the board passing rate is like I was like, okay,
Yeah.
that's it.
Yes.
So why not the U.S. medical school? So
Hmm.
I when I first came in, like so I took the MCAT the first time,
Okay.
and I didn't get like such a high score, and
Okay.
knowing what I know now, my studying strategy was just awful. Because my team was just like, I just read a book. I didn't even like do a question bank. I didn't do anything. I just read the books and I went to the exam day.
Hmm.
I didn't even do a practice exam, nothing like that.
Right.
And this is why I say like one of the biggest things when it comes to medicine is information.
Yeah.
And I believe like lack of information kills.
Mhm.
A lot of people that have such great potentials to do very very well,
Yes.
but they just lack that information, and so
Mhm.
they end up like just like not excelling to like their potential.
Right.
So like being in medicine is key, like to get like information, but to get the right information.
Yeah.
Um, so I did the exam again, like same thing. Like now I kind of like know about questions a little bit. So I did well on the chemistry and the physics section, but like not too well on the English section.
Okay.
So I ended up like being on the list for a couple schools.
Okay.
So I was kind of like in the valley of decision between like waiting and then just like going to Caribbean Medical School. And
Mhm.
at this point, I was like, like such a beautiful island,
Mhm.
uh good people, like different environment. I'm very very key on like environment, like change of environment and just like traveling around. So
Sure.
I think it was just like sold for me. So like I put out of the other medical like schools that I was on the waiting list, and I
Mhm.
just like went to the Caribbean school.
Okay.
So like my experience like at AUC like it's been awesome.
Mhm.
I mean, it was awesome now, I guess. So like, coming in first semester, obviously, like you don't like know too much about anything,
Right.
different environment, different people, like you have to get used to the culture.
Mhm.
So that was like first semester was a tough one.
Mhm.
You're trying to get used to everything, plus trying to get used to like all these materials that they're
Sure.
throwing at you, right?
Sure.
College and medical school is very, very different because
Yeah.
if you think college is tough, come to med
That's one
school.
thing compared to medical school. And the one thing, actually, I'm sorry that I'm just going to
So
slide
go
in
ahead.
here, is a lot of people think because it tends to be easier to get
Mm,
into a career medical school that the workload is easier, which is not the case because medical school where regardless of where you go to.
is
Correct? I mean, would you speak to that?
Yeah, so like I have friends because I have friends like in American medical schools,
Mhm.
and their workload like I even think it's less. Their workload is less than ours, to be honest. Because being a Caribbean medical school, I feel like there's always that mindset that you have to like prove yourself,
Yes.
obviously, and you have to like do well and do better,
Yeah.
and then like an American medical graduate. I mean, it's quite unfortunate, but it's the truth.
Hmm.
Like I'm gonna like come back and talk about my interviews and tell you why I think it's the truth.
Hmm.
So like then there's a lot of workload, but you trying to like prove,
Yeah.
you're trying to like do more, like that
Yeah.
more than the workload that you actually have, because you have a goal. And
Yeah.
I'm saying this to myself because everyone is different, like I have friends that came and just like chilled,
Mhm.
and like like after a few semesters they were like, oh, this is not for me. They left medical school.
Yes.
Um,
What
so
was the attrition rate? Do you know? Would you be able to speak to that at AUC? Was it a high or
I
low?
would I would say it was like it's low,
Okay, good.
like medium. So I started with like a class of like 126,
Okay,
and going into like third semester there was about like 80, 88.
okay, okay.
And like a lot of people dropped out because they just felt it wasn't for them.
Right, right,
And you're gonna come across this like during when you start medical school, like your friends like they just can't take it anymore.
right,
And some of them come back, some of them don't come back.
right.
And a lot of people, I think back then what they were doing was like two failed classes.
Okay.
I think after the first class you fail, like they give you like a warning or something like that.
Hmm.
And then after the second class, uh it depends on what class it is, they might give you like a warning. But after the third one, um they just like let you go.
You go.
I think that's what it is for AUC.
Right.
I don't know what the policy is right now because like with schools, everything like like the policies like change,
And yes.
changes. So if
Yeah.
that's something you are interested in, I would say like call one of the school the administration and ask them specifically
Right.
like what is the attrition rate and like how the students like fill out here.
Right.
So that would be a good question to ask. Mm.
Right. And I don't think, I mean, I don't think schools are out there to just send people off, or fail people. I think what people, a lot of pre-meds fail to realize is some people feel, okay, well, maybe because I was able to get into this school,
Right.
then, or some people actually might go into medical school for the wrong reasons.
That,
Maybe they're told they should go to medical school, or they felt they'll make so much
right.
money, or whatever
Right.
the reason is. It could be the wrong reason, and getting into it, you realize the workload and you're not even prepared. And
Right.
that's one thing I like to tell students: you have to prepare yourself for medical school, because it's a lot of work.
Yes.
It's not going to just be easy because you get to travel to an island,
Right.
you know. You're not, it's not going to be easy. You're going to study a whole lot,
Mm.
and the only time you get to really enjoy yourself is really maybe after tests or exams, if you are that dedicated student. And that's
Right.
something I just like to let pre-meds know also about, because that is what tends to drive up the attrition rate when students go in unprepared
Right. Right.
and not knowing exactly what it entails.
Right. Right. And that, I tell people because like I get a lot of questions and I get a lot of DMs all the time from like pre-medical students like ask me like
Yeah.
questions like this. And the thing I tell them is like it's medical school is a lot like mental, physical, and emotional. Very, very. And you have to be mentally prepared, physically prepared, and emotionally prepared.
Mm-hmm.
You're gonna come to the point in during medical school where things are not going so well,
Mm-hmm.
and you have to stick with it.
Yeah.
You have to figure out why things are not going well, and you
Yes.
have to figure out how to fix it.
Yes.
And you're gonna come to a point during medical school where a lot of your friends they don't even study as hard as you do,
Mm-hmm.
but do so well in exams, and you start asking yourself questions like, "What am I doing wrong?"
Yeah.
So it's very very emotional, and you have to be able to handle this emotion,
Yes.
the physicality that comes with studying. And like we many a times I'm studying like 16 hours a day,
Yeah.
like easily.
I hear you. Yeah.
Easily in a day, I mean 24 hours in a day, right? Easily in a day, you study 16 hours a day,
Wow.
and you still feel like you haven't studied anything.
Yes. I hear you.
And like you wake up the next day, you're like, man, I haven't done anything. I have to like, I have to keep studying again. And
Right.
it's like a cycle, right?
Yeah.
It's okay if it's just one day, but it's like a cycle. You have to like you have to do it every day, and you're getting materials every day, which means you have to like study every day.
You have to
Because
keep
what
up
happens,
with the material. You have to keep
right?
up with the material that you're getting. And God help you if you don't study for, say, 2 or 3 days in a row,
Right.
you know, I mean, you're already behind. And I think that tends to cause a lot of stress also if
Mhm.
students don't have the right study skills,
Exactly, exactly. As like that's one thing coming into first semester, you have to learn what works for you.
right.
And I always tell students like let your first semester be your guide.
Right.
Like I know like don't like I mean pass, but like don't get too carried away with like your grades in the first semester.
Mhm.
Use the first semester as a learning tool. Like understand your learning style,
Mhm.
understand like the hours you need to study to achieve success on the exam.
Mhm.
Understand like when you can take breaks.
Mhm.
Understand like how to prepare like right before the exam. Like understand the environment. Use that first semester to understand everything,
And everything, right.
and that way like going forward like coming to second semester like you have a plan.
Yes.
Like okay, this is what I need to do for this class, this is what I need to do for this
Right.
class,
Yeah.
like this is what I need to do for this exam, this is when I can go out with my friends.
Yes.
So like you feel like less stressed,
Yeah.
because I feel like a lot of first semester is just being like very very stressed
Hmm.
because there's just so much, and it's a new thing for you.
Right.
And I had like PowerPoint sometimes that were like 200 slides,
Hmm.
and they were like it was FT information in each slides, and you're like, man, how am I gonna get through this?
Get through
Slides?
it.
And that was just one class,
Yeah.
not like all the classes.
Yep.
So if you're coming in like like in college you have like 30 slides, like 20, like like 40 slides, like nothing crazy. I mean, I remember when I was in college, I was like, man, this is like a lot of theory,
Hmm.
and I started post semester of medical school. what is going on here? I was like, do they really expect us to like know all this things within
Probably.
3 weeks before the exam?
Right. Yeah. I
Uh,
mean, so you have to have a strategy. There's just no
right,
way around it. Yeah.
right.
Yeah. And with AUC, do they help students? Do they, you know, do you have advisors that you can go to if you're struggling? Because that's one other comment that I often see that, oh, you know, career medical schools don't support their students just like American school, you know, like American schools would. So
Right.
what type of support systems did you have in place when you were there?
So like during the school, like you had advisors that you can go to, and like I said, it was a small class size
Hmm.
that literally you can go to any of the office hours for the professors
Okay.
and speak to them one on one,
Okay.
and they can help you with the classes. And there were also support systems
Okay.
where like students that excelled in the class the semester before
Okay.
come back as teaching assistants,
Okay.
and they have certain days during the week where they give lectures to the students,
Mhm.
and they like tell them like this is what came out on the exam, like like when I was a semester before you, like I know it likes to ask these questions,
Mhm.
like get ready for this question. So that was very very helpful, right? Like
Right.
having like an actual student
Right.
that has gone through that class, like coming back to teach you and
Right.
give you like this like 30, 40 slides,
Sure.
pointer on like what you need to know for this exam, like what you need to know for this test coming up. So
Okay.
that was a big support system. And when I was in school, I was a teaching assistant.
Okay.
I was a lab chief teaching assistant when I was at AUC, American University of the Caribbean. And
Okay.
one of the things I did back then was like we had like lab sections where we help students with their dissection skills.
Okay.
And we also help with like just anatomy, like terminologies and going through like the structures in the body, the bones in the body. And like, a lot of the students appreciated that. Like there's so much stuff you can do doing like an hour lab session
Right.
with the professors. There's just so much you can do.
Hmm.
So like having that time with like this teaching assistants, like, like 4 to 5 hours, just like going through structures, like it's a walking, you can walk in, you can talk to anybody and they can help you,
Sure.
understand whatever, like, you don't understand, they can help you with your dissection skills.
Right.
So I feel like that was a big support system.
That's good.
Um,
Right.
in certain areas, like, I would say like when it comes to like financial aid, like it wasn't like a big support system, I would say, with the AUC, and I'm just being real.
Yes.
So I feel like that's one thing like they need to get better on. Academics wise, is very very good.
That's good.
Like some other section, like some other areas that are not academics wise, like when it comes to like rotations and stuff, like I feel like it could be better.
Hmm.
And it keeps getting better every year.
Of course.
But you have to come to a point during like your medical career where you can't let what the school is doing or not doing affect
Right.
what you have to do to be
Yes.
successful. And you're gonna come to a point like doing it doesn't matter what school you go to. Either you go to Canadian medical school or like American medical school. Medical school is very, very individual.
Yes.
You can't wait for anybody to help you.
Right.
And if you have a goal, you
Mhm.
have to go for it yourself, like understand what you need to do, not what the school needs to do for you.
Right.
What you
Exactly.
need to do and how you need to push the school to
Yeah.
do what you want them to do to get you to where you want to be.
Sure.
Because if not, like you're gonna come to a point where things are just not going, everything is going slow.
Yeah.
That's one thing I want to say is like just be like very, very trying to figure out the right word to use. Very pushy. Be
Yes.
very, very pushy when it
You
comes
should.
to like
You need to know what you want.
that.
Correct. Yeah.
You need to know what you want and
Hmm.
you need to have a plan to get it.
That's good.
And you need to be the one doing it,
Yeah.
not nobody else.
Yes. Yeah.
Like if you put your future in somebody else's hands when it comes to medical school and like rotations or like like applying and everything, like everything just gets lost.
Hmm.
Nothing gets done. Like you have to like follow up. You have to make sure everything gets done.
Yes.
It doesn't matter if you're American or like Caribbean medical school. It's the same. I
Right.
would say, yeah,
Right. The onus is on you as a student, and
exactly.
it uh, the amount of work you put in and the amount of your determination level and how much you ask for help also determines your success level. So if you're there just being overwhelmed with the schoolwork and you're just trying to figure it out on your own and you're not
Right.
reaching out for help, the help won't come to you, unfortunately. Whether you go to a small school or a big school, the benefit of a small school like AUC is at least you don't have so many other students to contend with.
That's great.
Um, and, you know, you can easily reach out to faculty. And most of Caribbean medical schools, and correct me if I'm wrong, at AUC, most of these schools have faculty that are either American or Canadian. I mean, they're faculty that have actually taught at U.S. institutions. So it's not, you're not talking to, you know, a faculty member who just is
Right.
the Caribbean, you know, who may not understand. You know, again, medicine is medicine, regardless. But the beauty of offshore Caribbean medical schools, at least, you know, the very good ones, you get faculty members that have actually taught at U.S. institutions as well.
Right, right. Yeah,
Yeah.
majority of my professors like were American, and I had some of them that actually worked for Kaplan, for
Okay.
Europe in the past. So they had like a good amount of knowledge as
Yes.
to like when it comes to like these USMLE exams and
Yeah.
the kind of question. I think my pathology professor back then taught pathology for Kaplan.
Oh,
Previous,
wow.
it was such a good knowledge because he understood what materials you need to actually cover for the step one. So that was like such a good like knowledge for us as students. And some of like the other professors like were like like professors here in America,
Okay.
and a lot of them were doctors also in America for several years before they retired, and now they're just like teaching faculties.
Right.
So like like that's one thing I think that's a good point. Like like although it's a Caribbean medical school, a lot of the professors are very, very well versed and
Yes.
well experienced and have actually like taught in America. And so they understand like what you need to like know for the exams.
Exactly.
And like you said, I think that's a big point when it comes to help. I
Mm-hmm.
think a lot of students like just go through and they try to figure everything by themselves.
Mm-hmm.
And in medical school, it doesn't work like that. Like, like if you're struggling, you're struggling. If you don't know something, there's a reason why you don't know it. And I'll be the first to say, like, there's certain classes I just wasn't too good at.
Mm-hmm.
And certain classes, like I didn't even like need to study much, but I was like, okay, I'm done.
Mm-hmm.
So if you need help, like like ask for help. Don't be too prideful to
Mm-hmm.
ask for help. Like asking for help doesn't mean that like you're below or you're small or like like anyone is trying to belittle you.
Mm-hmm.
It's just it shows courage. It
It,
shows
mm-hmm.
it shows strength,
Mm-hmm.
and it shows like that you're willing to do whatever you need to do to be the best at this class that you're not so good at.
Right.
So when it comes to medical school, like if you're not getting something, ask for help,
Ask for
and
help.
you're gonna find out like it's such a small part you're missing, like such a small piece you're missing, just to figure everything out. You're like, oh wow, I didn't think
Right.
about that, and
Exactly.
and then it just clicks for you.
Yes.
So like you ask for help. That's my thing. Like don't even like doing rotations,
Mm-hmm.
ask for help.
Mm-hmm.
Like I feel like a lot of people like pride kills,
Mm-hmm.
especially when you start actually rotations and like like you have like things you want to ask for like letters and stuff like that, and you're just like waiting like I don't really want to do it, like I don't like this person, I don't like that person, I think I can just do it by myself. No, if that's the mentality you're gonna use to come into medical school, like I mean
Yeah.
I can tell you right now it's not gonna work.
Right, right. That you're just in the wrong field, period, if you have that attitude, because you would need help every step of the way, you know, until you're done. Even when you're done, you still have to have a great relationship with your colleagues, you
And
know.
that, mhm.
So yeah,
Even
so
like even like some of the doctors I work now with and attendants, like
mhm,
there's certain times like there's certain like part of medicine that is just not the area stronger. And a lot of them will call it like their friends, like they know a lot more about the material and be like, oh, like I have this patient, like like I know like you have experience with this in the past. Like can you tell me what you did?
right,
And it's respect. If you don't know something, ask. And the goal of medicine is to give your patient the best care.
right,
If your opinion you feel is not the best, your option is not the best, and
hmm,
somebody else's option is the best, it's whatever is the best for the patient.
exactly,
So like don't be too prideful to just like say I'm just gonna go with what I think it is, even though you're not sure,
sure,
and then the patient suffers because you don't want to ask for help. So always ask for help. Like like not now, past medical school rotations, even when you start your medical career,
yeah,
like certain friends like doing residency that I know like they're strong at certain like areas, like maybe like neurology than I
mhm,
am.
mhm,
And because I know like they're trying to go into that field, I'm
right,
like, okay, like I have this patient, like what do you think? You
right,
know?
right, right.
Yeah.
And you would always need to ask questions at every stage. Even as an attendant, I've been an attendant now for the past 10 years.
Right.
Once in a while, I might have a patient and I'm thinking, okay, I think this is what I would like to do with this patient.
Right.
But I might just, call up a friend, who's, in the similar specialty and just, run it by them as well. So you would always need that help. You cannot be a silo in this field.
Right. No, you can't. I mean, that's the reason why there's different specialties in medicine.
Yes, exactly.
It's such a vast field that you can't know everything.
Right.
And that's why there's all the specialties, like they focus on just one area,
Right.
and they're just the best place to go for help,
Yeah.
It doesn't mean like you're less of anybody. It just means like that's just not your field.
Right. Exactly.
And you seek help from the experts in the field to give your patient the best care.
Yes. That's
Yeah.
great. So, wow, you've given a lot of great nuggets to my students, the pre-meds that'll be watching this video. And, I really appreciate all the advice you've given them so far. I do have a couple more questions though before we round up today. So you talked about your experience on the island.
Right.
Now, walk us into, and you did talk about clinical rotations.
Right.
Walk us into, finishing rotations and then matching into residency, and then talk about your current residency program and how you're doing there.
Right. So very interesting, actually. Like I said, like college, I was thinking IM or pathology.
Right.
And then I started medical school, and I love the section. I love the lab.
Mm-hmm.
Like I don't know something about people hate the smell, but it didn't get to me. So I was like, you know what? I think
I hated that from
the smell. I have friends that would skip all the time because they just couldn't handle the smell. So like I personally I loved it. I love being in the lab. I love dissecting. I love like seeing the structures. I took pride in it. And at this point I'm thinking I was like, wow, surgery is probably the way. So now I am pathology now, surgery.
Okay.
Like this, what I'm trying to say is you're gonna switch careers so many times. You're gonna switch paths so many times until you actually do clinical rotations. That's what I'm trying to get to here. And when I started clinical rotations, coming in, I was like, surgery was my second rotation. And I was so excited. I was like, this is it. Like this is what I've been waiting for. Like this is where I need to be.
Right.
And I remember like my surgery rotation back then was like at 4 a.m. in the morning. And I had to like wake up at 4 a.m. in the morning. And I was like, you're late. I was like, what do you mean I'm late? I'm like, this is 4 a.m. in the morning. I was like, they're like, you're supposed to be here earlier. Like maybe like 2 at like 3 a.m. to like look at the patients. I was like, really? So at this point, I'm like, I don't like this.
I think that helped you decide, make it.
And then I was like, I don't like this. So I was like, okay. So I started coming in earlier, like, just because this is what I wanted to do. So I wanted to show like the attendance that I was serious. So I started coming in earlier, just like doing the clinical rotations and like looking at the patients, like presenting, like during the morning rounds and stuff like that. And over time, like after 3 to 4 weeks, it started to get a little overwhelming for me.
Okay.
I feel like my personality is very, very cool, calm and collected kind of person. And I don't like stress, to be honest. So that environment, surgery environment is a very stressful environment.
Yeah.
And depending on where you do your rotations at, where I did my rotation at, the attendants were like just very, very like they stressed the residents. This was such a terrible, like this was a sad time in my life because after 2 years of like first 2 years of medical school, you're like you have this mindset like this is what you want to do, like nothing else, and then you come in to do it, and 5 weeks in, you're like stressed and you don't like think you can do it for the rest of your life.
Right.
So at this point, I'm like, what am I gonna do? Because at this point, like I was like not really thinking too much about like some of the other like residencies like radiology. Like I like, but I was like, just sitting by computer all day and just like talking to the microphone.
In a dark room all day.
Right. I was like, I don't know if I can do that. So I wanted something hands-on because,
just for the benefits of the listeners, radiology is an amazing.
Radiology is an amazing field. There's a lot of things you can do with radiology. You can do it like you don't always have to like just like look at like the thing. And I feel like if you appreciate pictures, if you appreciate like seeing differences and contrasting, like radiology is for you. My point is personality tells a lot about what path you're gonna go down.
Yes. Yes, you're
Um,
correct.
so like if your personality is like pictures, like your personality is like always like in the camera, like you're probably gonna love radiology.
Mm-hmm.
So if your personality is like very, very strong, like you don't care what people say, uh, you like a lot of like hands-on, you're probably gonna like surgery
Right.
because like no matter what they throw at you, you're like it's okay. Like I don't
Mhm.
like it.
Right.
Uh, so like now, like at this point, I'm at an impasse because
Mm-hmm.
like I did psych and I love psych.
Mm-hmm.
Like I didn't like think I was gonna like it, but I actually loved it.
Right.
Like because psych, you see everything in the book, you read all these things in the book, but it feels different when you actually see a patient in front of you
Right.
with this disorder,
Mm-hmm.
and you're like, wow, like this because when you're reading the book, it doesn't feel so real.
Mm-hmm.
Like they have all these Siggy cabs and like psychosis, like all these delusions and
Right.
all these things, and like okay, like this can't be real. I came across one of my patients, and he wrote a book, and it was about conspiracies and all those things, and he felt so strongly about, and it felt so strongly about it. I was almost convinced myself. And so like psych a lot because it's very interesting because you see all these things that like you read in the books that are actually not like there. But I came to anesthesia and I didn't know anything about anesthesia before I came into residency. I mean clinical rotations.
Mm-hmm.
And so we had that 1 week in surgery where I did anesthesia for 1 week. And so I came into this place the first day, like 5 a.m. in the morning. They were like, "Do you know how to place IVs?" I was like, "Well, yeah." Like, I mean, I was a medical lab tech. I was a phlebotomist like for like a good amount of period in my life. I was like, "Yeah, like I do this all the time." So they're like, "All right, place IVs on other patients." I was like, "Really?" So that was like my first day. I was like placing IVs on all these patients that were going to like the surgery, and I was, like putting like needles in and all that good stuff. So I was like, okay, like this is cool. Like this is something I can jiggle with. Like
Too.
yeah. So
At least on day one, at least,
this is
right?
on day one. This is on day one, and this is one thing you're gonna find out. Like when it comes to the specialty you like many times in the first week,
Yeah.
you're like, this is it. I can see myself doing this for the rest of my life. And
Mhm.
that was my thing with anesthesia. Like that 1 week, it only took 1 week.
Mhm.
Surgery was to 11-week rotation, but for anesthesia, like I love the fact that it was hands-on, which was something that was big for me.
Mhm.
Like I love the fact that I was placing a lot of lines, IVs and central lines, and like a lot of like ultrasound guided injections.
Right.
This was something it was a familiar environment for me, I want to say. Being
Mhm.
a medical lab technician in college, like phlebotomist for about 6 months in college. Part time I was doing like just to make money. So it
Right.
was an environment that felt familiar to me.
Sure.
And so I love like critical thinking involved, so like physiology and pharmacology.
Mhm.
And I love like physiology in school, like and your medication stuff, like I love because the thing with anesthesia is like it's an instant effect.
Mhm.
And like you actually get to see the medication work in seconds.
Right.
And and give it about an hour or two, like the patient is off the medication and you don't have to worry about it. So like that instant gratification also, that was like big for me. Like a lot of like IM and stuff, like you have like some of the medications like the SSRI, someone like take like 4 weeks to work, or you have
Right.
to like
Of course. Right.
so a lot of like stuff with IM, like it takes time to work. So
Yes.
like in anesthesia, there's that instant gratification. You see everything like working real time.
Wow.
And so like that was big for me. I was like, okay, this
I
patient
never,
is knocked out.
I never thought of it that way, but it's so interesting the way obviously I know what an anesthesiologist does, but I just never thought about it of that, just that, the
Right,
fact that, yeah, okay, that's true,
right. It's that instant gratification,
uh-huh.
and they feel like they come out of the medication and they feel fine. Everything is okay. And
Right.
I feel like there's a lot of critical thinking involved. And when I was in high school, I played chess a lot.
Okay.
I was part of like a chess team, and like so like thinking about stuff was big for me. Like with chess, like you're always thinking about moves. That's the game of chess. You're thinking about like what your opponent is gonna do, and you're
Right.
thinking about how you're gonna counter that move. And I
Hmm.
feel like in anesthesia, that's the way it is because you're going into surgery, you're thinking about like everything that's going to happen to this patient during surgery. You're looking at all the comorbidities that the patient has. You're
Yeah,
like, okay, like this can happen. Like, how am I going to fix it if it happens?
if it
This
happens.
can happen. How am I going to fix it if it happens? And
Mhm.
now that you're very prepared, because you have everything you need to fix whatever might happen during the surgery. So I
Right.
think like being in anesthesia, like that was like my thing, like was chess for me. Like
Right.
okay, like yeah, you're moving pieces, like okay, like the pressure is high, like I'm gonna like give this medication, like okay, like I'm gonna do this. The artery is high, like I don't like that. I'm gonna
Mhm.
like give this medication. So there's a
Okay.
lot of like piece moving,
Yeah.
and I feel like
Mhm.
anesthesia like controls the OR. Because a lot of people are looking up to the surgeon is looking up. The surgeons can't do anything without,
I know.
your opinion,
That's
and
right.
you like, making sure the patient is calm, like during the surgery. And the techs are looking up to you.
Mhm.
Um, the nurses are looking up to you. So you're kind of like this calm in the storm.
Mhm.
It's the way I think about it.
Right.
You're just calm in the storm. Everyone is like, everything is like everybody's like moving around. Like the surgeon is like doing the stand. The techs are like, giving instruments. The nurses are like moving around, and like
Mhm.
there's the X-ray techs, there's the CT techs, and you're just like this calm in the storm, like focusing on the patient.
Right.
Like like you're looking at everything that's going on, but like your whole goal is this patient care and
Patient.
making sure this patient is okay during the whole procedure. So you're like that calm and
Yeah.
like the storm around you. So
And
like it being
it fits perfectly, like you said, with your personality.
exactly,
Like,
exactly
right?
that. So like this was my thing. Like my personality just fit it right into it.
Yeah.
And like and a lot of the things I do in my life, like I said, I'm a musician. Like I'm an instrumentalist. I
Yeah.
play the piano, and I play once in a while, like here and there. Like not as much as I used to do.
Of course.
Uh, it feels like you're playing like when you play the piano, like you're playing several keys,
Mhm.
and it's like an harmony. You're trying to get one harmony, but you have to play several keys.
Right.
That's the way I saw the OR my first day. I was like, you're
Oh,
playing
wow.
all the several keys or like strings or whatever you play as an instrumentalist,
Right.
and the goal is one tune, and that's patient safety.
Oh, wow.
And
I
so
love
it's the way I thought about
love
it. Like
that analogy.
another analogy is the way I thought about it. I love analogies.
No,
As
that's brilliant, I mean,
you can tell. So at this point, I was like, this is it, and everyone, and I don't know if you've worked in anesthesiologists in the past, but it's such a calm environment. The attendance is so nice, so chill, so outgoing,
mhm,
and I was like,
this is it. Sign me up.
I was like, I'm ready. And so like at this point, like I did like other rotations, obviously, and internal medicine was second on my list. I
Okay.
love the fact that there's a lot of critical thinking in internal medicine, and you have to like it's a puzzle. It's the way I see it. I am is a puzzle. A patient comes to your office. They tell you all this physical. They tell you all this things that's been going on,
Mhm.
and they tell you like this travel history,
Right.
immunization history, social history,
Mhm.
and you do a physical exam. And now it's like a puzzle, right? Patient's like, oh, I have
Yep.
difficulty. You're like, okay,
Mhm.
lungs, heart, abdomen. So it's like a puzzle, right? That's the way I say I am is like, you're trying to like, you're trying to like solve a puzzle,
Right.
and based on the information the patient is giving you, the pieces, you're excluding stuff from your puzzle. You're
Right.
excluding until you get to like a final answer. You're like, okay, so this is what I think is going on,
Mhm.
and
Mhm.
then you can manage the patient properly. So I love that portion of IM. The portion of IM I probably didn't like was the rounds.
Okay.
I feel like there's several rounds during the day,
Okay.
and like you're constantly having to see the patients, right? You're
Mhm.
constantly having to like check on them. You're
Mhm.
constantly having to like round on them,
Mhm.
and like the notes. I mean, don't get me wrong. I mean, notes are okay, but I'm not like a big like note person, So I was like, and being an IM,
Yeah.
unfortunately, 50 it's about like 50% care and 50% like
Right.
administration work, and notes and making sure like proper diagnosis, proper ICD codes, or the hospital will call you like
Right. Yeah.
this code you write in this patient, this is not why the patient came in, and
Right.
this changes.
Your work never finishes. I mean,
Never.
and then the patient, after you discharge the patient, I don't know if you have to, like I am doctors, I mean, of course, would have to maybe even follow up on those patients
Right.
afterwards. So it never really ends. But
Never. This is the continuity of care.
right,
So
right,
you're constantly seeing the patients over time, and it's very gratifying in the sense that, especially if you work in the ICU, like a lot of those patients come in like, at the point of death, and
mhm,
it's gratifying if you actually like, get to see them like ill, ill over time, and then they get better, and then when they come back to like visits, they feel normal,
Right.
and so I feel like in that point is gratifying.
Yeah.
Um,
Hmm.
but I'm not the most patient person, I want to say.
Hmm.
So I like quick. I like quick. It quick in and out, and I just I can write notes like I mean I pride myself on writing a good note. And making sure like I cover everything like like labs and everything.
Hmm.
But I just don't see myself like doing like all that stuff all the time.
All the time. Right.
So like, and that's in that area it wasn't for me.
Right.
But when it comes to anesthesiology, you have to do a prelim year.
Hmm.
So anesthesiology is a 1 year prelim, which could be either internal medicine or
Okay.
surgery, and
Okay.
then 3 years is a 4 year program. So 1 year prelim and 3 years anesthesia.
Okay.
So and then the last 3 years in anesthesia. And obviously, I'm currently like doing my prelim in IM
Okay.
in New York currently.
Okay.
Um, so New York, I did most of my rotations here, so I just like felt like it's a comfortable environment, and that's why I'm doing my prelim here in New York. And like I say, surgery just didn't click,
Right.
so
Right.
it was a no-brainer when it comes to like doing the prelim.
Sure.
During I feel like IM like it's key because you get like see a lot of pathologists in IM,
Right.
and you get like understand a lot of like physiology in IM, and
Right.
so I didn't mind doing it for 1 year. IM for 1 year.
I
And
think
when it
I think IM makes more sense. I mean, I don't know
right,
personally. I mean, I'm
I
just
think so too.
for anesthesiology. I'm
Right,
thinking because I mean, you're not gonna do any surgery really. I mean, it'd be nice. I think it's good to know what the surgeons will do,
right,
but I think as far as just understanding pathology and understanding,
exactly. Mhm.
just different chronic diseases and things like that. That your patient
IM,
might
right.
have as as
Yeah, I think so too. I mean, a lot of people are disagree with me. Like like you're gonna be in OR for the rest of your life.
right,
Like so you can wait.
right, exactly.
So like it's good to like know this physiology and pathology and actually like these patients like with comorbidities and medications, right? I am like a good amount of medication, understanding all this medication
Yeah,
because you're gonna like do in anesthesia, you have to understand how this meds might affect what
right.
you're doing is during the surgery and how long the patient has been on the meds for and stuff like that. So I feel like I am was key when it comes to like me like thinking about like prelim for anesthesiology.
Mm-hmm.
So I mean, at this point, like like I said, 1 week in anesthesia, that was it for me. Like I said, like you're gonna find out that many times what you think you want to do during like first 2 years
Mm-hmm.
might not be what you end up doing.
Doing right.
And a lot of my friends like have the same like like this same opinion. Like I know a friend that came in that wanted to do OB-GYN, and
Mm-hmm.
now she's going into psych.
Oh wow.
So
Yeah.
like it's very very vast.
Right. Right. Right.
Like so like and
Yeah.
it's okay. So like you can have all these ideas, but you won't like really know until you do it.
Right.
Uh,
Yep.
that's the point. You won't know until you actually do it
Yep.
and see if you like it.
Right.
So like being in clinical rotations, like there's a lot of you have to be very very like you have to be hands-on and you have to speak out. I
Mm-hmm.
feel like in rotations, like you have to like make sure like they know who you are,
Mm-hmm.
and you have to make sure because if you're trying to get letters for residency application, like you want to make sure like the attendants like like know you very well
Mm-hmm.
to write you a good letter.
Right.
And the only way they can know you is participation.
Mm-hmm.
How much you participate during the rounds, how much you participate like during like like patient care or like M&Ms
Mm-hmm.
and stuff like that. So I feel like during clinical rotation, there's a lot of like coming in early. You want to be that person that comes in early. You understand what is going on before because most attendants like coming like on time.
Right.
Right? You can't come in on time. You have to be like an hour early. Like you have to like read up on the patients before, such that when the attendant comes in, like it doesn't even like need to read up the patient
Mm-hmm.
because now it's mouthpiece. Like everything that's going on. It's like, oh, okay, like okay, cool. Like let's just go see the patients.
Right.
And I feel like that's one thing with rotations is like you have to like be like very very on time.
Mm-hmm.
You have to be very very vocal.
Right.
uh, you have to be very early, especially if you're doing a rotation in a specialty you want to get into,
Yes. Yeah.
right? Especially if you're doing this, okay, maybe like if you can say, oh, like, okay, all these other specialties I don't like care about. But if you say you want to go into surgery, for example, You got to be ready to be there 2 a.m. in the morning, 3
Right.
a.m. in the morning, and like see all those patients, do a physical exam on all those patients, make sure like like they're ready to be discharged or they need like whatever. Like you have to make sure like you're on point and
Right.
you're ready to go once it comes to rounds.
Right.
You're ready to present and you're ready to like show that this is what you want to do for the rest of your life,
Right.
right? Because it starts now,
Yeah.
right? If they trust you with the patients now, they're
Mhm.
most likely to accept you into the program and
Right.
trust you with the patients as a resident in the
Right.
program.
Yeah.
And even though you don't match into the program, they're most likely to write you an excellent like letter of recommendation.
Yes.
Like for example, like I did, and I would advise like do it for all the specialties. But if you can't like be like this for all the specialties, at least for the specialty you're going to.
Hmm.
When I did my psych rotation, like like I wasn't going into psych,
Right.
but I'm a very very intuitive person, so I was like, okay, I'm gonna come in early, I'm gonna see the patients, so they are kind of like my work ethic.
Hmm.
And so my first week there in psych, like I wrote a poster presentation.
Okay.
My
Oh,
first
wow.
week in psych, so my first week in psych, my first patient, I wrote a poster presentation on that patient, and I submitted in a month.
Oh, wow.
And so they kind of like saw like it's like this student has a great work ethic.
Hmm.
So she was writing a book,
Hmm.
and so she called me. She was like, "Yo, I'm writing this book. Like, would you like to get on this book?"
Oh, wow.
Right. So
Was this as a medical student?
as
Yeah,
this
as a
was as
medical
a medical
student.
this was as a medical student. This was
Wow.
as a medical student,
Nice.
and she was like, "Would you like to like be on a chapter in this book?" I was like, "Yes." So I did research, and it's not something that you say you want to do, but like you take time, like you take months. Like I did all my research like night, like I had like all this like papers, like articles and everything, and I brought it to the office like within like a day or two, and we were just like sipping through articles and everything, and like the book is actually published now. It's on Amazon.
Oh, wow.
Yeah. So the book is actually published as on Amazon. But my thing is like it was work ethic, right? When it comes to clinical rotations, if people see your work ethic,
Yeah.
they're very, very willing to write you good letters of recommendation.
Yes.
They're willing to ask you, when they're doing poster presentations, to help with the poster presentations.
Yeah.
When they're doing research, they're willing to call your name because they know you're gonna work hard
Yes.
and they know you're gonna do they know you're gonna do the work. People don't like, like nobody likes to work with somebody that is lazy.
Right. Right.
And it's the truth, like nobody wants to work with somebody that slacks. If they know you're not gonna do the job, like, oh, you're gonna do the job sloppily, like they won't want to work with you.
Right. Right.
And I feel like going to rotations, you have to have that mindset of I'm gonna be here for this time and doing this 9 to 5 or whatever it is, like I'm gonna put in my best.
Yes.
So always put in your best. No matter what, I feel like my personally, no matter what specialty you are doing rotations in, you just put in your best because attendants talk to each other.
Hmm.
And this attendant was like,
And they're looking. I mean,
right.
they're paying attention. They're paying attention. You might think they're not, but
Mm,
like you said too, they talk to each other.
right.
So
No,
so
this attendants talk to each other. Even like different hospitals attendants, they still talk to each other.
oh yeah,
So
absolutely.
like you never know. Like I feel like, and that was like one of the big things. Like with why I got my residency in anesthesia. My anesthesia attendant, then
Hmm.
the the person that was like the hospital I matched into, like they kind of like knew his name, it was a big name,
Hmm.
and my letter of recommendation was strong
Okay.
for anesthesia because I was always going to these lectures. I was always like going to like all like the extra activities he was doing,
Hmm.
and I was always like there when it's like intubating, like doing this OR section.
Hmm.
So you have to show like you want to. I feel like that's the thing with matching into a specialty you want to get into,
Hmm.
and many at times that can overcome a bad score.
Right.
And I'm gonna say that because I know friends that the score is not great, and that's why I tell people like don't if you have a bad score, don't knock yourself out. It's
Hmm.
not it doesn't mean that you're not gonna get it, and still try.
Right.
The worst thing you can do is not try.
Right.
I had a friend that matched into radiology,
Hmm.
like not the greatest score,
Hmm.
but during rotations like they loved him. The residents loved working with him. The attendant like loved his work ethic. They like they loved everything about him.
Hmm.
And many times that's just enough.
Hmm.
And so many times that can overcome a bad score.
Right.
If your work ethic is very good, they're like, you
Hmm.
know what, like it might like not be great at score, but I know when it comes to residency,
Hmm.
this person is gonna work hard, and this person I can trust it. Like I can trust the family member.
Right.
And they're like, okay, so that's just all like they need to know. I need someone like I had like a 206 on a step exam,
Okay.
and she didn't match the
Step
first year
one.
on the step one exam, and
Okay.
she didn't match the first year. And she didn't do better on. She did a little better on the step two.
Mm-hmm.
She didn't match the first year. She did a transitional year,
Mm-hmm.
and this is a radiology example too. And she was always going to radiology, and they loved her.
Mm-hmm.
And next year she matched.
Oh wow. Yeah.
So like being coming to rotations is a lot of like work ethic. It's a lot of being hardworking,
Yeah.
being on time, understanding the patients, understanding like what needs to be done for the patients, and giving your opinion too. It's okay to be wrong when you give opinion. They understand you're a medical student,
Mm-hmm.
but at least they understand you're
Yeah.
thinking about it.
Right.
I feel like that's the thing. Like you're thinking about it.
Right.
Like it's just like saying, oh, like this patient came in with difficulty breathing, like chest pain, sporadic chest pain, and he's been smoking for like 30 years. And you say, oh, this is a physical exam, and then you just stopped it,
Right.
right? So, but if you say, I'm taking maybe COPD as occupation, like that's something else, like they're like thinking, okay, like you're thinking like in the right direction because it's a smoker,
Mm-hmm.
like there's no wrong, or it doesn't mean that's the right answer, but at least you're thinking
Right.
certain direction.
Mm-hmm.
So I feel like that's the one thing with like clinical rotations, like always like give your opinion,
Right.
and then like they might give you a feedback. Oh, okay, like okay, I didn't say it that way, and then you learn, and
Right.
that's how you learn, you
Learn
learn,
from it.
learn,
Yeah.
learn.
Yes.
It's a lot of learning, like
Right.
during rotations, how much you put in is how much you get out.
That, yeah, you're right. Just
So,
like medical school, how much you put in, when you're studying basic medical sciences, same thing. How much you put in is how much you get out of it.
right. So
Uh,
if you like study for like 4 hours or like 5 hours and you want to get a good like a great board score, it's most likely like not gonna happen.
right. Right.
Like you have to study, 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 do practice questions, and keep getting better on practice exams, getting better score, a better score, a better score on the
Mhm.
practice exams. And same to rotations.
Right.
You're gonna come to a point where you start to see like different patients, and now it starts to like form a pattern, right? You're like, oh, I've seen somebody like this before in the past, and I understand what was done for him then.
Right.
So now you can give a better informed opinion
Right.
as to
Right.
how you want to manage this patient.
Right.
So I feel like those are big things. And when it comes to like letters of recommendations,
Mm-hmm.
um, the thing with letters of recommendations is you want to start early.
Mm-hmm.
So if you're in a 6 weeks rotation, I would say like work out for the first 2 weeks. Like
Mm-hmm.
let them feel your presence. Let them know you're there,
Mm-hmm.
right? Let them know like your resident material.
Right.
And then 2 weeks in, like then you can tell the attendant like I'm applying. I mean, for when you come in, you let them know you're applying to the specialty.
Right.
And the 2 weeks in, you can tell the attendant like like I've been here for 2 weeks. I'm applying to this specialty. 4 weeks left. Like, would you be willing to write me a letter
Mm-hmm.
come the end of this rotation?
Right.
So now like they have it in mind, but you're still working hard, right? Now like they pick up curiosity and attention in you. Like okay, like let me see this student that wants a letter from me. Let me see how he participates in everything. So now like after the remaining 4 weeks, they can give a better informed decision
Right.
on your work ethic. They can say a little bit more about you and
Right.
about how you're gonna perform as a resident. So I
Right.
would say like start early, and a lot of the attendants are very very busy,
Mhm.
unfortunately, and they forget. It's the fact,
Yes.
and
Need to
so you
remind
always have to constantly remind them. And as I always tell people, before you leave the hospital,
get
get
it.
that letter.
Out of sight, out of mind. So get the letter
Once you leave, they don't remember you. I mean, because there's
I
so
mean,
many
it's not
things
really
that
out of
come.
mind, but they have other students that they have to,
Exactly.
teaching. So yeah,
So before you leave, get that letter.
get it. Yeah.
Like a lot of people were like, "Oh, I would just do it when it's close to."
Oh no, no.
No, don't do that. At least have them draft it out.
Yeah.
Okay, so that way once errors comes, like they can always go to the email. Oh, okay, like I made it already. Like I can just send,
Right.
they can just upload it.
Yeah.
So at least have them draft it out. Like that way, like like you're not calling and emailing, and
Right.
the email is not working, and the
Right.
phone
Or it
is
goes
not
into their
working. Like,
mail or
nothing
something.
is working.
No. Yeah. No. You're right. Definitely. You're right.
So that's key. I think that's very very key when it comes to rotations. I feel like those are the big points when it comes to rotations. Like this is like a transition into residency. Um, you don't have to be the smartest student. You don't have to be the best, student.
Mm-hmm.
You just have to be hardworking.
Hard
I
work.
feel
Yeah.
that's what they want.
Yeah.
They want you to like take care of the patient like you would take care of a family member.
Yes.
Like put in the work, put in the time. That's it. They know like you don't know anything about this much. They know you don't know how to like make a decision when it comes to surgery. They're not expecting you to know like the anatomy or like where you have to go
Right.
through all that stuff. They don't expect you to know that stuff,
Yeah.
but they expect you to know why the patient is coming to the OR,
Mm-hmm.
right? They
Yeah.
expect you to like know what kind of surgery they're doing for the patient.
Exactly.
And I had this example actually when I during my surgery rotation, like this was the first week, and there was a bariatric surgery,
Okay.
and like I was a naive student at this point. I didn't know anything about like clinical rotations,
Mm-hmm.
and so I walked into the surgery, and the guy was doing a sleeve gastrectomy
Okay.
for the patient. So I remember like during the surgery, I was like, so what part of the stomach are you cutting for the sleeve gastrectomy? and and the attendant started laughing. And the attendants started laughing, and the PA started laughing, and they were like, I remember the attendant was like, "It's a sleep gastrectomy, man. It's a sleep gastrectomy. What do you think?" I was like, "I don't know."
Sleeve, as the name implies, right?
The name implies. So at this point, like the attendant was like, "You okay? You don't like know? Okay, like do you like know why this patient is here?" Okay. I didn't even like know why the patient was there because I was just a soldier on the board. I was like, "Let me just go in and
Uh-huh.
see what's going on." I was like, "Hey, like what do you know about the patient?" I was like, I don't know. So he asked me at the end of the procedure. I was like, "You didn't even answer my question." I was like, "I don't know, but I can get back to you." I feel like that's the one thing you can always do is like, even though you don't know, like you can always tell them like you get back to them,
Mhm.
read up on the
And,
material
it,
and
and
then
make sure you
present
get back.
right and then present it right.
Right.
So like now like the guy is like one of my friends because he remembers me now. Unfortunately, it's a bad way to remember somebody.
But hey, you worked hard, you're where you are based on just your work ethic and everything you put into it. So
Exactly. So like yeah, it was funny, but like I came back and explained everything to him. Like now, like I know a lot about bariatric surgery just because of that one experience.
yes,
And that's the thing with medicine. Like it's okay not to know,
right,
but it's not okay to figure out why you don't know it.
exactly,
Right? Once if you don't know it once, it's okay. But
right,
once you figure out you don't know it, you can't just come back to the surgery the same next day and be like, oh, I still don't know.
right, yeah,
That's not okay. Okay,
hmm,
once is okay, but like coming in twice and still not knowing like what it is, like like that's not okay. And the attendants like don't like that,
yeah,
when you do that. So like I did that, and like I said, like now rotations are done. Like I have on my letters of recommendation,
okay,
like great letters. Like I did my letters from people like I worked with personally.
hmm,
It's always good to get letters from people that know you personally.
yeah,
You work with personally, like they know your work, they've seen your work.
hmm,
I mean, obviously, if you can't get like letters from them, like you can get letters from other people that will write you something good.
yeah,
So
that's
all
good,
my letters are in, like I'm applying to different places. Most likely I apply in the New York area, the Florida area, places like I know like I wanted to like match into,
right,
residency. So my top two programs were here in New York,
okay,
and then the Florida one.
okay,
And I pick my once you go to all the interviews,
mhm,
during the interview sessions, if you don't get as many interviews as you want, you can always email.
okay,
You can always call, program coordinators. You can always email the programs,
right,
and like like when you email the programs, don't just email like tell them why you want to come to the program. Obviously,
hmm,
what interests you in the
I
program.
trust you, yeah,
Like that way they know you understand like the structure,
right, right,
right, of the program. Like they're more willing to reply to your email, knowing that you understand the structure of the program.
yeah,
So like a couple of the interviews I got was from emailing
hmm,
and just calling, extra interviews. And it's a lot of money. This time is a lot of money, right? Like you spend a lot of money. It's you're very unsure of what is gonna happen,
right,
but you still have to spend money
of course,
for it.
yeah.
Um,
So,
so,
So help the pre-med students that are listening to understand.
Okay.
So with anesthesiology,
Right.
it is a competitive residency, and there is that misconception that if you attend a Caribbean medical school that you won't match into residency, or if you do match into residency, you can't really match into a competitive residency. So and you talked about the hard work you put in, and you really gave my audience just a lot of nuggets on how they need to prepare.
Right.
So with anesthesiology, your first year is your prelim year, correct?
Mm-hmm.
And then, so your residency program, is that in Florida or in New York?
So my anesthesia residency program is in Florida.
Okay,
But with anesthesia during your prelim year, you can do it like in different hospitals. It doesn't have to be in the same hospital.
I see. Okay.
So certain hospitals, so the way with anesthesia works is there's a categorical program,
Okay.
and then there's a um, advanced program.
Okay.
So categorical program just means you're doing your 4 years
Okay.
in the same hospital, the prelim and the 3 years in the same hospital.
Okay. Okay.
Advanced means you're doing 3 years of anesthesia at one program, or you can pick the first year to do in a different hospital.
I see. Okay.
So you don't have to stay in that hospital for that first year.
Okay.
So that's the way anesthesia works.
Okay.
So depending on what programs you're matching, if you match into a categorical program, you're most likely going to be in the same program for prelim and then 3 years. If you
Okay.
match into an advanced program, you're most likely going to do a 3 years advanced in that hospital, and then you can choose to do a prelim year in that hospital or choose to do a prelim year somewhere else.
Okay. Okay.
So I chose to do a prelim year in Virginia, in New York,
Okay.
because my family is in Virginia.
I see.
So it's about a 5-6 hour drive. So that was one of the big things for me. I was like, oh, you know what? I can stay an extra year in New York and I can see my family
Okay.
for about, at least a year until I move to Florida, which then is going to be tougher,
Mhm.
to see my parents.
Sure.
So that was my big decision as to why I'm doing my prelim year in New York,
New York. Okay.
rather than just staying in the same program.
Sure. That makes sense. I met you at Emily, United States Medical Licensure Exam.
All
Not
right.
bad.
So USMLE, I think like the average for the US graduates were like 220s,
Okay. Okay.
and for Caribbean was like for international medical students were like 236 and 240s.
Okay. Okay. Okay.
Step one and also for step two. So
Okay.
I would feel like this is what like the averages, but obviously you should try to shoot more than the average.
Okay.
All right. I would say being in the 250s is a safe place to be.
Okay.
Being in like maybe 230s on the step one, 240s and 250s on the step two.
Okay.
I would say like that's a good place to be stepwise for anesthesia.
Mm.
You get a lot of interviews, with those scores. But if you don't have those scores, and you know, uh, this is for like students I guess coming into medical school. So like this is what you should shoot for.
Okay.
But I guess for anybody that's watching that, like you're done with like exams already. If you don't have those scores, like it's still okay to apply. The worst you can do is not apply, honestly,
Right.
and the worst you can do is not give yourself a chance.
Right.
I have like friends that were in the 230s and the 220s on step one, 230s on step two, that
Okay.
matched.
Okay.
They had like less interviews, 3 or 4, but like they matched, right? Because the attendants like love the personality during the interview. They love the personality, the vibe, and that was big. And a lot of like interviews is like a good amount of scores, right? But once you get into the interview, you're on the same like level, like you're on the same level field
Mhm.
as anyone else that like that has an higher score or whatever. So at
Okay.
this point, like it comes down to how you do on the interview.
Okay.
So I would say being in the 240s and the 250s is a good place to be,
Okay.
a secure place to be, because anesthesia is a tough specialty to get into,
Yes. Mm-hmm.
and especially as an international medical graduate. And I say this because unfortunately, uh, like they take like students in America with lower scores.
Really? Mm.
Yeah, actually, because during my interview, I had friends that that would tell me, oh, like some people talk about scores during the interview. I was like, I don't care.
Mm.
But I have people like that were in the 220s, American students that were in the 220s.
Oh wow.
Like 220 and then 230s in step two on the exams, and they got interviewed.
Oh wow.
And like I some of them are international medical graduates. You have like 30, 20 to 30 points more than these people.
Mm,
So it's kind of this case where we are right now, especially when it comes to competitive specialties.
yes.
And it just tells you like you have to do very very good on the step examinations. I know the last step one is like it's gonna be pass or fail,
Yeah. Well,
like
but
very soon. I think
yeah,
like not right now, but like very soon. It's something that is in the works. I think.
and works. Yes.
Um,
I believe it's actually, hasn't it already started? I thought it
oh, it
started.
is. Oh, okay.
I mean, I would have to look into that, but I believe, well, I know it was, they were talking about it, but I'm not
Right.
sure if it started yet or if it's,
Yeah, I think it's gonna. I think not this year. I think like the coming the coming cycle. I think it's gonna be a pass or fail,
okay,
and then like so it's gonna be just based on the step two exams.
okay.
So like like obviously like like do well. Like the highest you can get is what you should get.
Mm,
So don't settle for like like 230s because that's what the average says.
right,
Like shoot for like an higher average,
yeah.
and like matching into residency is like 70% scores. Obviously,
Hmm.
and but a lot of other 30% is like networking. I
Yeah.
want to say networking and knowing somebody that knows somebody.
Hmm.
And I have a friend that matched into ophthalmology because his wife has a cousin that was an ophthalmologist at that hospital,
Wow.
and was like an attendant for like a couple of years there, and that was the connection.
How was it?
Unfortunately, I mean, it works like that. It's like politics.
Yeah.
It's just politics. A lot of people don't like to talk about it. Like many medical fields, it's politics and it's an industry.
Hmm.
Unfortunately.
Yeah.
So like like, but I feel like if you can use it to your benefit,
Hmm.
So if you have friends and know people, like reach out, like network. If you like know somebody, they know somebody, they can get you an interview.
Yeah.
Like reach out to those people, right? If you have a friend that matched into anesthesia like a couple years ago, like like you can reach out to them, and say, oh, like I know you matched here, like I'm applying this year, like can you help me?
Yes.
Talk to the chairman or the program director.
Yes.
And so these are ways I feel like you can use to get interviews.
Into right. Right.
Then when you're applying with your scores, and I think I had a student that was a semester above me that matched anesthesia.
Okay.
And I was like like messaging him to like like help me like get like interview and stuff like that. So like you can always like use that route, and it's always good to like like people that have matched into it. It's always good to ask them for advice.
Hmm.
When you're applying to specialties like that, like because they know better as to like what you need to do
Right.
to match into those specialties. All
Okay.
right, so like I always like tell like some of like my friends now like that are applying, like I mean I obviously can't help you right now because I'm in my prelim year. I don't carry much weight right now. But I was like, like down the road, like, like definitely, like, I mean, if somebody reaches out to me and be like, like, I'm trying to match, and they tell me about your scores and they tell me about stuff, like, I can always talk to the chairman and put in work to,
Of
like,
course.
or at least offer you an interview.
Yeah.
So this is the thing, like, when you start like medicine, be nice to people, right?
Yes. I was just about to say that.
You
Don't burn
never know,
bridges. You never know.
right? You never know where you're gonna meet them again, right, in the future, right?
Right.
And you never like know, if they're gonna be able to help you down the road or not,
Right.
right? The worst thing you want in during an interview is coming in and they're like somebody like mentions your name and the attendant says this is a horrible student,
Hmm. Hmm.
and be nice to people, help as much as you can, you
Right.
know.
Right.
During like when you start rotations, don't burn bridges, like you said.
Yeah.
Like people can help you or they can bring you down.
Right. Yeah.
It's
They
there's
can
it's
make you or break you.
make you right. They can make you or break you. They can make you or break you. There are people like I've had a lot of students go for interviews and they, like just because like that attendant wrote them a letter
Hmm.
and the program chairman will be like, oh wow, I know I've worked with this attendant
Right.
before, so I
Yeah.
trust his opinion. If
Yeah.
he says you're good, like I'm willing to like take you for an interview and
Right.
take you to my program, and that's all it takes.
Right. They don't know anything about you, but they're going just based on what
Based
the
on
attendant said.
that,
So
like don't burn bridges. Like it can make or break you, like you said.
yeah.
So it's like that's another big thing when it comes to like interviews. Be nice.
Yes. Yeah.
Be calm, be chill. You
Mhm.
know, like it's a fun time in your life.
Yeah.
Um, and you know, like just go with the flow. You know, help as much as you can. You know,
Wow.
like be nice to residents. Be nice to like the the people that clean the you know like the people that clean like they clean the place.
Right.
Be nice to the police officers in the hospital
Yeah.
because like you know like interview starts from when you're walking. You know,
Yes.
if you're like not nice to the people like oh but our resident was very rude and
Right.
that's it.
Yes.
That's all it takes.
Yeah.
Done.
Yeah. You're right. You're right. The program coordinator, you know, can
Right.
easily
Mark
influence.
is the best friend.
Yes. Yes. So you're so right. You have to be
Mark
nice.
is the best friend. That's actually one of my boys that just matched into Surgeon in Florida also.
Okay.
And only matched because the program coordinator liked him.
See?
So she was like, oh wow, like she was like you're applying here? Yeah, it was like yes, I'm applying here. And I was like, okay, don't worry, I'm gonna put in a good work. That was it.
So,
And he matched it.
wow.
And you know, he was telling me like not the greatest call, but
Mhm.
he was telling me like, you know, like that coordinator said she was gonna put in a good word for me. And
Yeah.
that was all it took.
Yeah. Wow.
And that's the thing I'm saying. Like you might have a bad score, but you can't have a bad score and a bad attitude.
Right.
You know, like you can't be both. You know,
A
like
double-edged sword.
right. You have to be up for one of it. You know, so
You're right. Yeah.
good to have a good score and a good attitude. But if you can't get a good score, at least I have a great attitude.
Attitude,
And
right.
I have a great attitude towards life. I have a great attitude towards the environment, towards the people that you work with. You
Yeah.
know, be friendly. Like you know, be somebody that I can say I want to work with for 4 years. You know, because
Right.
residency is a long time.
It is.
You know, like the worst thing you want is working with a resident that is very arrogant
Right. Yeah.
and doesn't get anything done for 4 years. You
Yes.
know, like nobody wants that.
Yes. No one
You
wants.
know, like and I feel like that's one big thing that you know, like they look at doing interviews. Like, you know, no, the attendants don't want somebody who will ask them for like 4 years, you know. It's like
Right.
a long time.
Yeah.
The relationship.
Yeah. Mm.
Medicine is like marriage, you know. It's your wife
Yeah.
or husband.
Yes. Yes. No, I hear you. Yes.
So you know, like be nice. Be nice,
Wow.
I would say.
Thank you. Wow. You've given us a wealth of information. Thank you. Wow. You know, students, any pre-med or even a medical student for that matter, watching this video would gain so much, you know, so many nuggets, so many recommendations and advice that you've given will definitely go a long way to help students. And I really, really appreciate you doing this.
So,
I know you have your own, what you're working on and, you
right,
know, with
right,
students. And, you know, just tell us a little bit about that for you also for the benefits of pre-meds that might want to follow you
right.
you know a little bit more about what you do for them.
So right now, like I'm working on a series. I'm working on a book,
Okay.
and the book is called The Diary of a Caribbean Medical Student.
Okay.
And what this book is going to entail is going to talk about the journey of medical students
Okay.
from college through the struggles with MCAT or no struggles, through medical school, through the struggles with the first 2 years, the basic sciences,
Hmm.
you know, how they studied, you know, how they adjusted to the environment, the emotional aspect of it, the studying for the board examinations, what they felt was very effective for them, studying for the board examinations, going into clinical rotations, right? How they approached clinical rotations,
Okay.
right? How like they were able to, you know, get letters of recommendation,
Hmm.
you know, like how they figure out what specialty they were going to get into
Okay.
and how they like you know match into the specialties
Okay.
and it's going to cover like different specialties so it's going to be like medicine radio all the specialties are going to be on the book and
Right.
it's going to be a student that match into the specialty from a Caribbean medical student or from an international medical school
Hmm.
and just talking about the journey and also like international students are like from like different countries
Yes.
like talking about the journey as to how like they took all the steps and what they had to like do to get a visa and everything. So it's gonna be a great wealth of knowledge in the book.
Yeah.
And the reason why I came up with this book idea is because I personally have been getting a lot of like you know like emails. I've been getting a lot of like messages, like people asking questions.
Hmm.
And I feel like in medicine, like information is key. And like I started with a lot of people that have such great potential, but lack information so they're
Yes.
not able to achieve this potential.
Mhm.
So like having this wealth in the same book, and pre-medical students can read it by coming into medical school, and they can have a good idea of what medical school is,
Mhm.
what the struggle that it entails.
Right.
When it comes to studying, when it comes to exam, when it comes to emotion, when it comes to relationships.
Right.
Like I have students that break up like during like med school and like that like tore them apart,
Yep.
and I have other students that like we go throughout, and then the couples match.
Mhm.
So
Yeah.
that couples match is gonna be on the book also, and what they have to do to like get into the same or hospital, couples match and surgery, IM and stuff like that. Like these are like big points that are gonna be in the book. So it's such that when you read, like it can help you like make better decisions,
Yes.
and like why they went to that specialty, right?
Okay.
So like when you read it, you can say, okay, like I can, this person is like me, so I
Right.
probably would like this specialty.
Yeah. Yeah.
So it's most likely gonna be next year,
Okay.
April. That's the timeline currently for the book.
Okay. When it will
But
be released? When it will be
when it's be
released?
released,
Okay.
right?
Okay. Okay.
And so like like the journey is gonna start like I started like I'm posting like snips and snippets very soon, like on my Instagram. My Instagram is doctor underscore TAYO Tayo. So
Mhm.
like doctor underscore Tayo. So you can follow me on Instagram. Like I have a YouTube page.
Okay.
I have a podcast where I just like talk to medical students. I talk to my last one was on like just a medical student. We talked about like pre-medical stuff. And we
Okay.
talk about like MCAT. We talk about like the scores you need to get on the MCAT.
Okay.
We talk about like how to study for the MCAT. Writing your personal statement for the MCAT, stuff like that.
Okay.
So that was the last YouTube video, and I have like a podcast also. So it's
Okay.
a wealth of information, but like you're doing, and this was one of the reasons why I came on, because going through college and going to medical school, yeah, especially coming from Nigeria,
Mhm.
it was tough for me. A lot of the I don't know what I call now, the advisors
Mhm.
were giving me the right information.
Information.
Like I told them I wanted to do medicine. Like they were giving me like classes that weren't even in the direction of
Mhm.
where I wanted to go to.
Right.
And so I wasted about about a semester
Mhm.
during college just doing like nonsense, just
Right.
because the advisors like didn't know what they were doing.
Right.
And like so a lot of like the book and and my podcast on YouTube is talking about my mistakes,
Yes.
and just like helping other people learn from my mistakes as to like what I would have done. But like I was talking about the MCAT, like knowing what I know now with board examinations and how to study effectively, um it could have been a different approach for me.
Sure.
So helping people like understand like my struggles, my journey through my medical career, and how I think you shouldn't make that same mistake. And it's all information. It's all information.
Excellent.
So yeah, follow me on Instagram. The book is coming on soon.
The Diary of a Caribbean Medical Student,
That's
correct?
that's the name of the book. Yes.
Okay. Okay. And your podcast is
My podcast is Hanging with Dr. Tayo.
Hanging with Dr. Tayo.
Right.
Okay.
And the link is on my Instagram, on my Instagram page, Doctor underscore Tayo.
Okay. All right. So pre-med students, not non-traditional pre-med students watching this video, you can go to the Instagram page, podcast for Dr. Tayo, like he mentioned, and get even more information.
Right.
Dr. Tayo Akadiri, thank you so much for
Welcome.
this wonderful interview, a wonderful wealth of knowledge that you provided my audience. I'm tremendously grateful, and I'm sure my audience is grateful as well. And
Right.
before I wrap up today, this is MedmatchMD. What we do is we help pre-med students make an educated decision about choosing the right offshore Caribbean medical school. Dr. Tayo went to an amazing Caribbean Medical School, American University of the Caribbean, and there are so many other schools. So visit medmatchmd.com to find out more about AUC as well as other Caribbean medical schools out there.
Right.
Once again, audience, thank you for listening today and have a wonderful day.
All right.